Great to have you. Since we're in lockdown now, we can't be live together. I should say we can't be together in person, but we can be live on the education platform here, or Facebook Live, I should say, and Zoom, to bring you Two Anatomy Geeks. If you've been following us for a few weeks, many of you have been, we've been sharing information around the ankle and foot complex on this series. And our goal through this series is really to help educate you, to help you up a level your skill set, your mindset, and to learn anatomy and to make it fun for you, because many of you are like, oh, this seems so boring and I don't get it and it's confusing and it's just not fun to learn. We're here to make it fun. I should say, I'm here to teach you, and Jill's here to make it fun as she teaches you as well. So briefly, if you are not familiar with us, if you're brand new to our community, welcome. Thank you so much for joining us. I'm a chiropractic physician, and when I graduated chiropractic college over 20 years ago, actually 22 years ago this year, I started teaching at the massage therapy school, the SOMA, National Institute for Clinical Massage Therapy. And what I realized quickly was that a lot of these massage therapists knew more about anatomy than I did as a chiropractic physician, because we didn't get a lot of anatomy. We should say we got lots of anatomy, but not hands-on anatomy, and not truly understanding functional anatomy as we're going to share it with you. And one of my students in my early classes, actually back in 1999, dating ourselves a little bit here, Jill, was Jill Leary. And she was really, I remember her, she was a great student, very inquisitive, knowledgeable, professional. And here we are, 21 years later, and now Jill works with us here in our clinic. So Jill, welcome, thank you. We're super excited to do this series to educate, empower, and uplift the massage therapists that are watching this, fitness professionals, as well as other healthcare professionals. So would you mind introducing yourself, your background, and why anatomy is so special to you?
Well, I love science. I love it. I love everything about it. I love learning it. I think the more you learn, the more you want to find out. And sometimes the hard part is kind of just getting back into it if you haven't looked at anatomy for a while, because you're like, oh, I think I know that, or I'm worried I'm gonna feel stupid if I go back and I look at something. But once you start, you get so into it that you want to learn more. And I think learning things in small short segments, like we're going to do Dr. Osar, really helps you to kind of get a better grasp of it. And a lot of the stuff you already have either using, or you did know at one point, or you did use, and you're gonna be like, oh my gosh, it makes it make more sense to me. And I actually think it makes working more fun when you have more knowledge, kind of to use. So for me, yeah, I've been working as a licensed massage therapist for 20 years, and I've worked with so many different types of clients. I've worked with athletes, I've worked with stay-at-home parents, I've worked with people who are ill, like hospice patients, people that are in oncology at hospitals. So I've really gotten to work in a bunch of different environments, and I have used anatomy in every single one of those environments.
Awesome. It really serves you, and we're going to share with you why and how knowing anatomy can serve you. And obviously we're on lockdown right now, and we have a very serious issue going around our country and our world. And many of us are fearful of our jobs, our financial future, our income, our relationships, our health. And many of you in the health and fitness industry, you're like, what's going to happen from this? What am I going to survive? And now you've even seen on social media that everybody and their brother is a health and fitness guru and giving exercises. They were selling real estate a couple of weeks ago. Now they're doing health and fitness, So what we want to do is help you educate yourself and empower yourself and up-level your skill set and knowledge and skill set. So that way you will come through this. There's going to be a group of leaders out there that emerge from this stronger and more resilient and ready to lead and serve. And that's really why we're bringing this information to you. So what is this going to be all about? It's going to be about understanding why you need to know anatomy. And there's 3 specific reasons I think you really need to know anatomy. And I should say, I believe that you need to know anatomy. Number 1 is it gives you a foundation. It really gives you a foundation for understanding how the body works. So when I say anatomy, we're also going to discuss biomechanics, so how joints move and forces that control and regulate joint motion, but also what the muscles do. And muscles are always under the guidance, or I should say under the control of the brain and and nervous system. So it's not just anatomy, but it's also anatomy, biomechanics, how joints move, and also, so it's basically ABC. A is anatomy, B is biomechanics, C is control, the motor control, how your brain and nervous system controls and tells the muscles what to do. Muscles just react to what they're being told. And we'll talk about how they're also very important proprioceptive organs or structures, I should say, to give the central nervous system information. But the brain and nervous system tell muscles what to do. So when we talk about muscles, we're not just talking about muscles, we're talking about how we're communicating to the nervous system. So it gives you a foundation for how the body works, how the nervous system works, and then how you can also impact function. Because it'll give you a perspective. The second reason is so important. It gives you a perspective so that way you can understand and appreciate how the body moves, what goes wrong with it. So the reasons why your clients experience chronic tightness, discomfort, and just can't perform at the levels they need to and or want to. And also to understand and have a perspective when you listen to other people talk about exercise or posture or movement or pain or, massage therapy, for example. You just don't take their word because they're gurus. You take their word or you take the information and you have a foundation to put that information through, a lens, so to speak, we like to say. You put it through your lens because you understand functional anatomy and biomechanics and motor control. And you say, hey, does that make sense based upon what I know to be true or what our current understanding is of functional anatomy, biomechanics, and motor control? The third thing I think anatomy is real important is it's going to help you develop yourself into a specialist. Like I said, there's so many generalists out there. There's so many people that have their hands in health and fitness right now, especially now because it's trendy and it's something to do to pass the time while we're all on lockdown. But as Jill sort of illustrated, this is our passion. This is our life. This is not a hobby. This is not something we're doing because we can't make it as actors or musicians or real estate agents or investment people. And I'm not making fun of those people. I'm just saying this is what we do. This is what we've been doing for 22 years and my 10 years of education before I became a chiropractor. This is what Jill's done for the last 20 plus years. She's educated herself, and she was a nutrition, was it registered dietitian or nutrition?
Yep, still a registered dietitian, but not practicing. But I keep it up. Yeah.
Yep. Awesome. And so this is going to help you be a specialist. And when this all passes over, because we'll get through this, it'll really differentiate between those of you that want to be and are leaders, specialists in what you do, and the rest of the industry that's just trying to grasp on to the next greatest thing. So that's 3 reasons why we believe anatomy is so important. Now, next, Jill, you're going to talk about like anatomy as many of us have learned it or how it's commonly taught in massage school or chiropractic school or physical therapy school. Can you just discuss like what anatomy actually is as you've taught it and as most of us have learned it?
Yeah. So when you're in anatomy, in an anatomy class, whether it's physical therapy school, OT, massage therapy, personal training, when you learn the muscles, they are teaching the muscles based on this anatomical position which you see, and it's a good starting point, but it's not the end of understanding what muscles do, because we don't stand in anatomical position all day long. All right, if we did, it wouldn't make for a very exciting life. So, but it's a great starting point, because when they started to decide how they should name the attachments or where the attachments were for muscles, they will always have an origin or origins for the muscle. They will always have an insertion or insertions for a muscle, and then an action. And origins usually, but not always, are going to be the attachment of the muscle that's closer to the torso. And the insertion is usually, but not always, the attachment that is further away from the torso. Also, the origin is usually, when we first learn about the muscle, the part that's the anchor to the muscle. And then the insertion is usually the part of the muscle that has the movable end. But as you learn, when you learn more about the muscle, is that insertions don't always move closer to the origin. Sometimes the origin in some of our movements, many of our movements during the day, actually moves towards the insertion. So that's what we're here to kind of show you, a different perspective, to think outside of the box of how muscles do things in real life.
Awesome, awesome. So give them an example of how we've all learned anatomy. We'll use the tibialis anterior, for example, because we just
Yeah.
talked about that on our 4-part series. One of the muscles we covered for the foot and ankle complex on Facebook Live this past month was the tibialis anterior.
Yeah, so with tibialis anterior in kind of the position that we're in right now, it's sort of hard for me to show it to you, but we will going forward with some of these, with a lot of these muscles, all of these muscles kind of show you where their origins and insertions are on an actual body. But in this picture, we're going to use this. The tibialis anterior has an origin at that anterior proximal shaft of the tibia and some of the interosseous membrane. So basically the front of the leg. And then it comes down and it goes to, you can see the under the medial arch of the foot, and it has an attachment or attachments on the plantar surface or the posterior surface of the foot. So the origin is at the tibia and the insertion is at the plantar surface, bottom surface of the foot. So when you think about the kind of the rule of thumb when you first learn anatomy is that the insertion, the movable part, will move towards the anchor, the origin. So if we do that, what this arrow is showing is that you have the foot actually pulls up toward the shin or the tibia. So insertion moving closer to the origin. And you can either just do that by pulling your foot up, you know, towards the shin, or something we do during the day is when you're walking and you're going through that swing phase, meaning that you have, you know, most of the weight on one foot so the other foot can pick up and kind of move forward. Notice that you do put your foot into dorsiflexion so that your toes don't drag on the ground. So that's a great example of when we would use dorsiflexion during the day.
Absolutely. Awesome. Great description of tibialis anterior. So what happens in real life with gravity? So the downward force of gravity, as well as ground reaction forces. Ground reaction forces are essentially, it's basically Newton's law of equal and opposite. So as hard as your foot is hitting the ground, that force is coming back into your body equal and opposite. So that's why being real optimal and efficient in your posture and movement is such an important part of joint health, of muscle health, of overall body health. Because we also have what happens when we load our body up with weights, with children, with groceries and external loads. So all those things start to impact us. And as Jill said, we talked about the origin insertion and the action, the insertion coming closer to the origin, which happens usually when the body part is not attached to the ground or in contact with the ground. But what happens to the ankle and foot complex when it's actually on the ground? So if we're taking the tibialis anterior, so I'm not sure why that muscle's not showing up here, so let me just click out. So if you look at the ankle, so as you're stepping forward and the tibia is progressing over the ankle joint, so the tibia and fibula are moving over top the talus, the tibialis anterior is helping to pull that tibia forward. So again, it's still creating dorsiflexion, but now the foot's on the ground. It's helping to create that forward momentum or the motion of the tibia over top the ankle joint and the ankle and foot. And it's also helping because it's attaching underneath the plantar surface of to the plantar surface of the foot. It's also helping to maintain that medial arch as the body weight is coming over top of it so that the arch just doesn't collapse. We want the arch to lower, but we don't want it to collapse. So tibialis anterior helps to progress the tibia forward over top the ankle joint. It also helps to maintain that medial arch as the body weight is moving over so the foot doesn't completely collapse. And that's what we mean by the anatomy as we've learned it as anatomists have described it, and how we generally learn it in OT school, chiropractic school, physical therapy school, massage therapy school, and you may have learned as a fitness professional. But functional anatomy is, what does it really do in everyday life? And we'll also talk about in this series what happens when these muscles don't do their job because of injury or surgery or trauma. So we'll discuss that as well. So what we're going to end this discussion with is our Two Anatomy Geeks monthly series. And when I say monthly series, it's actually going to be a weekly series where we take a certain body part. For example, like I said, on Facebook Live, Jill and I last month, we just finished up this past week. I did it without you, Jill. Unfortunately, it wasn't fun. It's fun for me because, you know, you weren't there. It probably wasn't as fun for our viewers either. But this past month, we talked about ankle and foot muscles like anterior tib, posterior tib, we talked about the soleus, and then earlier this week, I talked about the abductor digiti minimi and the abductor hallucis, two important intrinsic muscles of the foot. Next month, we're going to talk about a different body part and muscles related to that body region. So what we're going to talk about is anatomy and also palpation. So as Jill discussed, Jill will cover the anatomy. Where does the muscle attach to the origin and insertion? And then also Jill, because you're a massage therapist and we get taught as manual therapists, chiropractors, physical therapists, OTs, how to touch muscles. And I think it's very helpful for personal trainers, fitness professionals. Let me just back up here. I don't know what's going on with my presentation here. But I think it's also very important to understand where these muscles are. So even if you can't touch your client, if your license doesn't allow you to touch your client, I think it's very important to be able to feel the muscle either on your own body, or you take a family member or a colleague or a friend with permission and palpate the muscles, so you start to learn where these muscles attach to on a human body.
Yes. Is this my turn now, Dr. Osar?
It is.
Okay, good. I just we're getting
Sorry,
clear.
got left you hanging there.
I'm trying to look at you. I didn't want to step on any toes.
No,
So when we're talking about palpation, it is actually, if I may, the term palpation comes from a Latin term that means palpatio, and it means to touch. And that also makes me think of patios, which makes me think of someday being able to sit out on a patio with other people. But I digress right now. I just wanted to, someday. So why we palpate, or why we want to touch the muscle, is because it's our ability to target the muscle, and to also assess the muscle and to kind of feel, does that muscle feel like it's ropey? Does it feel sinewy? Does it feel like it's, kind of upregulated? Does it feel downregulated? And I think what I've learned while I've been working with Dr. Osar and Janice and Sarah at IMS is that when you can feel the muscle, it helps your brain to be able to feel the muscle. So even if you as a trainer or therapist are not able to touch your client or palpate the muscle on them, you can help to guide them to where that muscle is, because then the client's brains will be able to know where that muscle is, so that if you're trying to cue them into getting that muscle to downregulate or relax or to engage in a way that it's supposed to normally or optimally, that them being able to know where that muscle is at is very, very important. So palpation, you can't, you just have to understand that it is important, and we're going to show you how to palpate some of these muscles as well.
Awesome. And again, we're going to teach you, even if you don't use your hands or can put hands on, it's still, as Jill said, very valuable to be able to feel where the muscles actually are, to know where the biceps attaches to understand where the tibialis anterior is, and feel what happens when it contracts, so you can actually feel it moving and understand, like, when a client says, oh, I have pain right here in my shoulder, not that as a fitness professional you're treating pain, but you may understand, like, hey, this is a biceps brachii there. Maybe it's getting sore on the client because their shoulder is coming too far forward because they're putting too much pressure on that biceps tendon. So you understand what the muscle is, what it does, where it is, and commonly what causes common issues around those muscles, so you can educate your client on that.
Awesome. And I've noticed too that with the releases that that we teach or that we show clients, I can do the releases on a client because it's within my scope of practice as a licensed massage therapist. But for those of you that may not be able to do that or don't feel comfortable knowing where the muscle is through palpation and knowing the origin and the insertion, it will allow you to show them how to use a foam roller in the appropriate area and how to do it in the appropriate way, or whatever release technique you might use. It will be more beneficial.
Absolutely. And speaking of which, we're going to show you then how to do self-myofascial release. So that's a great lead-in, Jill. So this is our great friend and colleague and good friend of mine and certified integrated movement specialist, Anthony Nuzzo. He's also an instructor for our certification program, the Integrated Movement Specialist Certification Program. And he's showing a self-myofascial technique for the shoulder. We'll show you that as we get into the shoulder. So we want to teach you things that you can use to teach your clients how to go home and do, because it's great that they're with you for 1, 2, 3 times a week. And again, now we're not with anybody live. We're doing everything through live streaming, which is this is awesome benefit of technology, is we will teach you, as Jill said, how to teach your clients how to do self-myofascial release. And one of the things that we are very specific about, and Jill can attest to this, as opposed to even massage therapy school, or what we learn in massage therapy school, or what I was even teaching massage therapists, I should say, I wasn't teaching this because I wasn't teaching this component of it, but in massage therapy school, they teach you just kind of how to release muscles. There wasn't really a specificity to it. And a lot of myofascial, even self-myofascial release techniques, it's just like, hey, just go foam roll the body. What we teach as part of the integrative movement specialist is to be just that, a specialist. And you just don't tell people just go home and foam roll because it's good for you. No. We teach you how to assess and then specifically target the right muscles for release, knowing of how to feel and how to palpate or understand how to release and where to release. More importantly, where to release. Because if your client is having, say, hip tightness, for example, you don't want them to just go stretch and release every single muscle around the hip joint unless it's appropriate. And frequently, as Jill, you found out working in our office for the last few months prior to our lockdown, is we're very specific with where we release. It's not just about go find some tight muscles and release everything that can possibly be released. It's all about specificity. Can you talk about some of that you've learned also working with us here in the office?
Yeah, understanding the idea of not chasing the tightness of a muscle, and using assessments to determine what muscles do need to be targeted in that amount of time that you are going to be spending with the client, and releasing those muscles with that, like for example, the foam roller that you see on this slide, or a tennis ball, or all the little doodads that we've got in the office to help with release of muscles, and to kind of let those muscles know that it's okay for them to relax.
Mm-hmm.
I always think of muscles as like little people, and some muscles need to just like some people need to be told to relax. So you're telling them to relax, but then also, as Dr. Osar will probably talk about, that having a muscle relax is great and release, but then also telling that muscle, okay, you still have to do your job. So getting it to be reacclimated to doing its job in the correct way to help the joint move in the correct way.
Which is, again, a beautiful lead into our next point, Jill, corrective exercise. So,
I did not plan this.
We didn't plan this at all either.
Yeah, as you might have noticed.
Let's just get on and do our thing and see what happens. We'll fix it as we go along. So one of the things we want to teach you how to do as well, one of the things I talked about on Facebook Live today, so on my Facebook Live page, Evan Osar, I talked about the importance of putting your stake in the ground and really claiming what you do and who you are and what you can be best in the world at. What we are best in the world at is assessment and corrective exercise. We've been studying this for over 20 years. We've traveled around the world studying with some of the best people in posture, movement, and exercise, from manual therapists to physical therapists to chiropractic physicians to exercise specialists to movement specialists. And that's the beauty of, like, we all have a skill set, sort of our Superman skill set. My Superman skill set is I know how to take information and plug and find out what makes sense, what doesn't make sense. I have enough knowledge, foundation of anatomy, biomechanics, and motor control to understand what information we can use, should use, what information is sort of doesn't make sense. That's what we do. We do assessment and corrective exercise better than anybody. We put our stake in the ground. I wrote a book over 10 years ago called Corrective Exercise Solutions to Common Hip and Shoulder Dysfunction. I'm currently working on the second edition. We are corrective exercise specialists, and we're going to help bring that information to you because, as Jill said, as massage therapists, as chiropractors, we learn to release things, mobilize joints, stretch things out, mobilize soft tissue and fascia, get things moving. But we don't do a good enough job at teaching people how to reacclimate or reuse or reintegrate that muscle into a more functional sort of muscle synergy to control the joint and to provide more optimal and efficient posture and movement. And that's what we're excited to bring to you as well as part of this series, is we're going to teach you how to use the muscle once you've released it, how to reintegrate it into functional movement patterns through corrective exercise, and why you need corrective exercise and why you should incorporate it. And if you don't do it, how to do it well. because like I said, we're best in the world at it. And another thing you can work on is being best in the world at what you do for your clients. So we'll do that during this series as well. Now, as Jill also alluded to, we also have to integrate this into everyday exercise. And you see, again, my colleague and friend, Anthony, doing this literally 125-pound Turkish get-up. Now, the importance of integration is being able to use this muscle as part of a complex, because one of the things that people will oftentimes criticize on, they're like, oh, Dr. Osar, you just teach muscles in isolation. Muscles don't work in isolation. And we 100% understand that. We are not teaching you a muscle to say this muscle does this function and no other muscle does, and no other muscles are important. We're teaching it to you in this manner, so as Jill said, it's a small tidbit of information so that it's not overwhelming to try to learn everything. But ultimately, we want this muscle that we're working on or addressing to work as a functional whole. So for example, if your client is doing a Turkish get-up, 125-pound Turkish get-up, like Anthony is demonstrating here with amazing form, that they know how to use that, for example, the biceps in this position so they don't create further injury and still perform at a high level. So we want to take the muscle once you've released it, once you use your corrective exercises to make it function better as a functional unit and upregulate and use that muscle appropriately, but then also integrate it into the fundamental movement patterns and functional exercise progressions that your clients need to do to safely and effectively accomplish their health and fitness goals. And right now, Jill, you're working through the Integrative Movement Specialist certification. You're working with Sarah, and give some of your feedback on what it's been like to go through that process and learn how to integrate this information into some of those fundamental movement patterns.
Taking the information that I've been getting and being lucky enough to, not only do the schooling, I guess you could say, online, but then also being able to come to the office and then use what I already know from teaching anatomy and being a massage therapist for many years, and understanding how I can make somebody not just feel better, but be able to move better in even a shorter amount of time than it took before. I don't know if that's the best way to describe it, as I've noticed, is to be able to get somebody to feel better and to move in more of an optimal way, and to reach their goals in a faster, more efficient way than just depending on one thing to do it, like just depending on exercise or just depending on massage or just depending on whatever, fill in the blank, that it takes a team. And I've always preached that, and I've always said it takes a team, but sometimes you don't get to find the team, or a client might not be able to find the team. And I think what's nice is you are kind of given a team of people showing you the different things that you can incorporate, and you can kind of, in a way, be that team for yourself. Not saying you'd also want to be able to have other people to refer out to and get information from. You shouldn't be an island, but you can have a bunch of different perspectives in your brain all at once.
Awesome. Totally agree. It's all about working within your team and working within your skill set, and also having that team of individuals around you to help support and do the things that you don't do as well. Like, I can do manual therapy. I'm really good at it, but Jill's frankly better than me at it. I teach movement and exercise, but frankly, Sarah Fisher, our certified integrated movement specialist, is better than me at it. So like I said, my skill set is I know how to take a lot of information, distill it down, and give you the highlights, the key points, the pertinent points, how to strategize, how to put it all together through assessments, to corrective exercise, to functional integration. There's people that are better at the individual skill sets that I'm not good at. So everybody has their specialty, and the more and better team members you have and surround yourself with, the more effective you will be in serving your clients and also attracting more of your potential clients to you. So in conclusion,
one other quick thing, Dr. Osar, is going back to like this, the Two Anatomy Geeks, like being able to take like almost like three different perspectives and putting it together to talk about one muscle, you know,
Yeah, exactly.
taking all that together and putting it and be like, here you go, here's 10 minutes of information about this muscle.
Yep.
From origin to insertion, from action to using it to, you know, releasing it to getting it to, you know, wake back up and do what it's supposed to do.
Exactly.
Love it. I'm so excited about it.
Me too. And people, like our community has wanted this for a long time. And so far they loved our Facebook Lives. So essentially in recap, we're going to give you perspective on muscles, how muscles work, what goes wrong, and what you can do about it as a health and fitness professional. We're going to teach you the function of the muscle as well as part of the whole. So that way you can then decide the most effective exercises if that's your specialty as well. And finally, to help you develop just into a specialist. And as I mentioned, during this entire month or 2 months or 3 months, if it goes longer, we're bringing this series to you completely free. There's no charge to you. There's nothing to sign up with a credit card. You just come and sign up and join us. We'll post we'll give you links to the recordings because all of these will be recorded and put into a library so you have access to them if you continue to join up once we're starting to charge for this program. So Two Anatomy Geeks coming to you every single week. We're going to discuss a different body region each month, muscles around that body region. And then also, like I said, record each of these 4 sessions so that after the 4 sessions, you'll have a really good look at some of the common conditions that impact things. Like, for example, coming up next month, starting next week, will be our first session. It's the shoulder complex. We haven't decided on a day. It's probably going to be Saturday for the time being because most of us are, you know, we got nothing going on. We can't leave our houses except to go to the grocery store. So right now, it's probably going to be on Saturdays. It may be on Fridays, but again, we'll let you know as we solidify a day and time. And again, if you miss any of these live sessions, we will record them and allow you access to the recordings. So like I said, it's completely no charge to us because again, our goal is to help educate you, empower you, help you up level so that way you use this time in lockdown to really strategize and get prepared because we will come out of this. Keep the faith, keep empowering your communities. And if there's anything we can do for you in the meantime, let us know. If you have questions, please let us know that too, and we'll cover that as well. But again, we're going to stick to the topic. So if we're doing the shoulder, don't ask us about the ankle. If we're doing the ankle, don't ask us about the low back. We're going to focus and stay addressing the area that we're focused on. So we'll finish up by saying thank you so much for joining us. Again, we're going to post this somewhere on all our social media sites. We'll be back at some point next week, likely Saturday morning. We'll let you know what time of day.
It'll be like a cartoon, a Saturday morning cartoon.
Saturday morning cartoons, the Two Anatomy Geeks tag. We'll see you next week for our first official, I should say maybe our second official, Two Anatomy Geeks. Thank you so much, Jill. Thank you for everybody that's watching us live or the recording. Have a great day.